New parents often wonder how to soothe a crying baby. It's a common challenge. Babies cry for many reasons, and understanding these can help. Sometimes they are hungry. Offer a feed, even if it's not scheduled. A baby might be tired. Look for signs like yawning or rubbing eyes. Overstimulation can also make a baby cry. Too much noise or activity. A dirty or wet nappy is a simple fix. Check and change it promptly. Discomfort from being too hot or too cold can also cause tears. Ensure the baby is dressed appropriately for the room temperature. Sometimes babies just need to be held close. Skin-to-skin contact is powerful. Swaddling can provide a sense of security, mimicking the womb. Gently rocking or swaying can be very calming for a distressed baby. A warm bath can sometimes work wonders, relaxing both baby and parent. White noise, like a fan or a special app, can mimic womb sounds. Some babies respond well to a pacifier, offering comfort and sucking reflex. A change of scenery, like a short walk outside, might distract them. Infant massage, with gentle strokes, can soothe and bond. If your baby has wind, try burping them gently after feeds. Bicycling their legs can help release trapped gas. Colic is intense, prolonged crying without an obvious cause. It often happens in the evenings and can be very distressing for parents. If you suspect colic, consult your health visitor or GP for advice. Remember, it's okay to ask for help when your baby is crying inconsolably. Don't be afraid to reach out to family, friends, or health professionals. Sometimes you just need a break. Place the baby safely in their cot. Step into another room for a few minutes to compose yourself. Never shake a baby. No matter how frustrated you feel, shaking can cause serious, irreversible harm to a baby's brain. If you're feeling overwhelmed, put the baby down and seek support. There are helplines and support groups specifically for new parents. Parenthood is a journey with its ups and downs, and crying is normal. Every baby is different, and what works for one may not work for another. Be patient with yourself and your baby as you learn their cues. Trust your instincts. You know your baby best. Keep a diary of crying episodes to identify patterns or triggers. Note down feeding times, sleep, and nappy changes. This can help you and your healthcare provider understand the crying. Sometimes, a baby cries because they are unwell. Look for other symptoms like fever, lethargy, or unusual rashes. If you are concerned about your baby's health, seek medical advice. It's always better to be safe and get a professional opinion. Remember that crying is a baby's primary way of communicating. They are not trying to be difficult. They are expressing a need. Responding calmly and consistently builds trust and security. Even if you can't stop the crying immediately, your presence matters. Your comforting touch and voice are invaluable to your baby. Take deep breaths and try to remain calm yourself. Babies can sense their parents' stress, which can escalate crying. Create a soothing environment. Dim lights, quiet, gentle movements. Singing a lullaby or humming can be very effective. The sound of your heartbeat from holding them close can be reassuring. Don't compare your baby's crying to others. Each baby has their own temperament. Celebrate the small victories when you successfully soothe them. And don't despair when you can't. You're still a loving parent. This phase will pass, and soon you'll understand their language better. Enjoy the precious moments of quiet and connection. You are doing a wonderful job, even on the toughest days. Every parent faces this challenge, and you are not alone. Seek support, practice patience, and cherish your little one. The bond you build through these moments is truly special. Love, patience, and understanding are the best soothing tools.